Hi everyone, welcome to Center of Balance. I am the fertility acupuncturist. Today our topic is female infertility causes. I'm setting up the other platform because I was setting up already, but it went off, disconnected, and I had to do it again. So give me a minute. If you're online right now, please give me a thumbs up and say hello to me. Just let me know where you're from, especially if you're on Facebook, Instagram, Instagram, and YouTube. So I can't see you actually, but if you say hello to me and I know who you are, because it will appear in front of me that I know, oh, okay, this is you, familiar, something like that. Okay, let's start soon. Go live. Yeah, Facebook's still quite slow. Sorry about that. It got disconnected, so I have to do it again. Well, our topic is female infertility cause today. Now, if you're a practitioner, let me know you're a practitioner. Now, let me know where you're from. Okay, if you are patient, and let me know, hey, yes, I'm not a practitioner. I just want to gain more knowledge through my live video. So have you watched my live video yesterday? We talked about what is infertility. Infertility is not about just female things, it's male and female, right? Still try to get the Facebook going. Okay, we have Healthy Heather Inca watching live from Nigeria. You are a practitioner. Thank you for being here with us. Okay, I'm sorry, I'm just still setting up the. Oh, it's not working at all. I have to reopen then. Let's reconnect Facebook. So Facebook is an issue at the moment. So yeah, we in the following days, like every day we're gonna talk about a little topic. So today is female infertility causes, and the following one will be male infertility causes. And then we're going to talk about still setting up. Okay, one of the YouTube is going, but the Facebook is still difficult. Let me set it up again. There we go. I hope this is going to work. It's going to work. I'm not sure, but maybe it's going to work. Maybe it's not. Finger crossed. Okay. Now, in the following day, we're going to talk about treatment as well. Well, treatment is Western medicine and Chinese medicine as well. And oh, okay, it's up now. All right, finally, the Facebook is up. So waiting for Eric, Veronica to join us, because they join us every day. And Joe, remember all your name. Familiar because you join us often, every morning, just about every morning. Okay, now our topic is I'm sorry that we've been late for Facebook because it kept disconnect. So I had to set it up. So it took about what 10 minutes. Actually, we spent about 10 minutes to reconnect it again. Well, thank you for being here and say hello to me first. Hi, Veronica. I'm good, thank you. My dad's pretty okay. Yeah, thank you. Yeah. So our topic today is female infertility causes, and tomorrow will be male infertility causes. Okay, so if you're here, say hello to me and give you a thumbs up, and on Facebook please tag your friend in and share this live video, and Instagram as well. You can share individually to your friend, your family, or your colleague. Okay, if you're a practitioner, please share, help me to share. If you're not practitioner, you want to gain knowledge from here, from me, and please share. If any of your family or friends is suffer from infertility or they're in fertility treatment, please share with them. Okay, I'll take the link afterward, after the live video from Facebook, YouTube. Please take the link to share with your friend, or take the link, share on your Facebook or Instagram as well. Thank you for answering my question about not using her. No problem. I didn't see it when you asked it, and so afterward I actually, oh okay, there is some question from there's a question from Veronica, so I type it in. No problem, happy to do that. Okay, right, let's start. Now, causes from of female infertility. Okay, female infertility can cause by a variety of factors that affect or interfere with the following biological processes. And number one is ovulation, and when the mature egg is released from the ovaries, right? And the others will be fertilization, okay, which occurs when sperm meets the eggs in the fallopian tube after traveling through the cervix and uterus, right? Implantation, which happen when a fertilized eggs attaches to the lining of the uterus, okay, where it can then grow and develop into a baby. So in those few things that are the key that for causes the infertility, female one. Okay, now let's talk about what is the normal things. Okay, when the eggs, okay, we talk about female. Okay, let's forget about male first. Okay, just the female. What is the normal one? Okay, about the eggs. Okay, so you have a lot of eggs. Okay, ever since you born, I can't remember how many thousand, the number. I really can't remember that. But if you counted, you release whenever you got a period. It used to be 14, age 14, but now it's much early. Like why causing much early? The younger start to get period very early. Okay, you need to think about this. I have patients' daughter. They got period when they were 8 years old. That is very early. 8 years old. Can you imagine that? In the past, little girl get period menstruation when they're 14. According to Phua Ltd as well. Phua Ltd say what 14 they get period, then they have the ability to conceive. This is Phua Ltd. And now 8 years old, 9, 10, 12, and we see a lot of fertility patients, and a lot of them say, well, I've got my period at 12, I've got my period at 11 or 10. That is very early, you know. So think about why it's so early. Okay, it's what you eat in your diet. What you eat. Those chicken, those KFC, McDonald's, all this meat have a lot of unhealthy stuff in it, a lot of junks, a lot of what we call steroid in it. So it stimulates your body, and stimulate your gland, so make you make the little girl mature faster. And a cup of milk, you know, drinking milk is the other thing that is not good for you. Why is that? Because the milk got the steroid that actually stimulate calf to grow, but that's not for human, you know. And in some cases it's stimulate to human to grow faster, right? So when you grow faster means that you age faster. Does it make sense to you? Okay, now this is something that's not right. Okay, my daughter 11 now, she hasn't got her period. Okay, why is that? Because our diet is different. We're vegan, you know, we don't eat those crap. Yeah, she's still growing but hasn't got her period. Why is that? Because we don't eat KFC, we don't eat McDonald's, we don't drink milk. You see, so this is something that it actually impact in ovulation, impact in your life, in your health. And a lot of people didn't realize that and keep eating that, and because majority people, women, they get period earlier now, and you think it's normal. Very first step is abnormal. As I said, not because if you think about all people doing the same thing and they have suffer from abnormal symptom conditions, then because majority of people have it, and you already put in your mind, say, well, this is normal because everyone have it. No, it's not. It's not. Okay, so you need to know the normal. Okay, back to the textbook and think about way back before. Alright, and ask about yourself. Are you period? When did you start your period if you're female? Okay, and ask about yourself. What about your friends? And ask about yourself about your mom. When did they start the period? If you started very early, hey, think about your diet as an issue too. Which your parents feed you the wrong diet too. Okay, so directly impact from the diet. Okay, you need to know that. Okay, so what? So the eggs grow. You only release one egg monthly. Okay, it grow. So a lot of eggs grow to a certain amount of big size. Okay, and then it wait in there. What for? Wait for the right time to release. When the hormone change, on the right hormone, right environment, it release. The eggs come out. So the eggs come up from the ovary. then through the fallopian tube, traveling to the cervix, traveling toward the uterus. Okay, then do you know that the sperm, when release the eggs in the sperm and egg, they are not actually made in the uterus, you know, but when implantation is in the uterus, they actually made in the fallopian tube. So, and they made together and become what we call embryo. The embryo need to go. This is where we call it about fertilization, right? So when they make together and become embryo, they need to move. It need to move from fallopian tube to the uterus and attach to the lining of the uterus. So we talked about yesterday, what is the lining? Who built up the lining? Lining is your blood. When there is no implantation, when there is no sperm and meet with the egg, so there is no ovulation and there's no embryo, right? So it won't happen with implantation. So which means that if there is no implantation at all, the lining will fall, and the whole, of course, the hormone change as well, and the lining fall. When the lining fall, it become period. That's where you become your menstrual bleeding. Okay. So the lining fall become period, which means the lining is built up from blood. Okay. Now, when we talk about this is what we understand. This is the process, right? From release the eggs to, so anything that it can impact the hormone, because when the hormone is right, then it releases the egg. So anything impact the hormone, then the hormone with progesterone, estrogens, okay, then this, anything like thyroid problem, cancer, stress, you know, stress related issues, anything impact that will affect the egg to release. Okay, that's first thing. Okay, now about implantation, for if the eggs meet together, it doesn't actually move to quickly enough to the uterus and implant in the uterus lining. And if implanted into it happens because it grows very fast in the fallopian tube, and that will become ectopic. You know, it's very dangerous if it's ectopic. Alright. AcuHealth Nature Cure Institute. Hi, say hi, Sunan. Hi, how are you? No. So the implantation, it need to be about 8 or 9 mm. The lining need to be 8 and 9 mm, something like that. When it's ovulation time, it need to be about 8 and 9 mm. Then the eggs released and the embryo will attach properly. If you haven't got, what I talking about is the lining of the uterus is actually a soil. If you want to plant a seed, you need a good nutrient soil. Okay, so you need a good lining and thick enough and got a lot of good stuff in that, which is nutrition and oxygen. So when the embryo attached in there, and it can help it to grow and develop into a baby. If you got too thin of that, it can still attach it grow, but it hasn't got enough thick enough of the lining. What happened is it will fall. When it grows a certain time, develops to a certain level, it fall and it become miscarriage. That's how happened. What happened? Okay. Now, what are the risk factors? The risk factors for female infertility including increasing of age. Increasing age. That in female, yes, we talk about you have multiple eggs. You're never gonna use it all in your lifetime because you only release one egg monthly. Okay, so you have multiple. But unfortunately, when you age, the egg quality become lower and lower. Although you still have a lot. Okay, and it become lower. So keeping up the egg quality is another thing. So become healthy, right? If you're smoking, think about the smoke, all the chemical thing, it went to your blood, it went to your lung, and when you breathe, if the lungs not healthy, you can't get enough oxygen into your blood. So the baby, the lining rely on the blood to develop it. So if you're smoking, think about you won't get enough oxygen, and the smoking, the chemical thing going into your blood, it become a toxin. So how would you be able to get pregnant and have a healthy baby? And when we talk about infertility, I'll talk about it. Well, getting pregnant is a start thing. Getting pregnant is just a beginning of your family. Why do I say that? Because do you want a healthy baby or unhealthy baby? And I would say everyone will say I want a healthy baby, and that's good. Then quit smoking then. I have a nurse who came in for acupuncture, and she was smoking every day, and she was trying to have a baby. And I talked to her about this, and she didn't get it. Although she's a nurse, she was a nurse. I'm not quite sure about her now. She wanted to have a baby, but she's smoking every day. She says, I just can't do it, but I want to have a baby. I talked to her about it, and unfortunately, she keep going with smoking. He said, yes, I know that, but I just couldn't do that, and I still want my baby. Wow. We're here to provide information and ask the question, and the patient do the right thing themselves, decide what they want to do. Okay. Now, heavy use of alcohol. Now, alcohol, smoking, and caffeine, coffee. The scientists have done a lot of research and study that actually affect fertility. Decrease the fertility rate. So this is important to know about. If you want to get pregnant, you want to prepare for pregnancy, stop smoking, we're not saying that decrease smoking, okay? We're not saying to decrease the caffeine or decrease your alcohol, because we will say, well, if you eat this, this is not very good, please, not so healthy, and eat it less. We're not talking about eat less or use it less. We're talking about stopping. No caffeine, no smoking, and no alcohol if you come to preparing for pregnancy. Okay. Now another thing, being overweight is the risk of it. I'm not saying if you overweight you can't get pregnant for all of you. I'm saying that it is a risk factor. A lot of people with overweight, that is one of the common thing that linked to PCOS. And we see obesity, you see that people overweight, they're unhealthy, they have some hormone problem that causing the overweight, they have not just not just overweight that impact their other health, that's impact with infertility as well, because the hormone actually out of balance. Then when the hormone out of balance, the eggs actually rely on the hormone to release. Okay, you have to get the right hormone to release the egg. Right, and that's another one. Well, overweight's not good, but underweight's not good either. I don't know. Well, when it comes to fertility, we suggest patients to do exercise. I don't know whether you do that or not, because as a healthy person, you do exercise, right? You keep it going every day. But well, of course, a lot of people don't do exercise because too busy right now on this lifestyle. But I've seen patients who are not underweight. Yes, underweight is a problem. I have my cousin who underweight and who got pregnant easily, but can't manage to keep the baby. Not enough nutrition. Okay, that is important to know. Well, some people, they exercise a lot, too much. I've seen patients who used to overweight, and one of them running. In my mind, there are two at the moment. I can recall two. One of them running every day. Now, overweight may cause you stop your period, right? And this patient ran every day, and what happened? When she lost weight, period stopped. Why is that? Too much exercise. Too heavy in exercise. Too often. High level of exercise is not good. Why is that? Because you use all your energy, all your blood, all the nutrition in your blood, and all the oxygen in your blood in your exercise. So you haven't got enough. It seems that they're very fit, but they don't have period at all. They skip the period for 6 months, for a year, for even 2 years, and they look healthy, like strong, a lot of energy, but they run every day. And I have another one who trained himself as a boxer, professional boxer, very fit, no period. They're not under any medication. They are so healthy, they're not under any medication, but no period a month, every month. So this is something that you may see, or you are exercise too much. Most people won't have this problem because this is very extreme. These two people are very extreme. They're doing exercise every day and few hours. Okay, train themselves very high intensity. But most people are overweight, right? Not because underweight. Right? I just need to point it out that exercise too much is not good either. So you need to know about this. What else? The infection. The infection in the bladder or kidney. Infection in the urinary tract. If that activities that infection often, like people get Monday. Some women get infection whenever they have sex, and you need to treat that infection because that infection causing infertility. The truth, a lot of people have this, so you need to treat this as well. They call sexually transmitted infection. So that can actually damage the reproductive system. Okay. There are some medical conditions as well. So what are the medical conditions? That a variety of medical conditions can affect the female reproductive system and cause infertility in women. Okay. Now we talk about the eggs quality and the hormone and the lifestyle things. You know, you can change obesity and infection, all these things, smoking, and there are some medical conditions. For example, ovulation disorders. The ovulation disorder, one of the more popular one is PCOS, which is polycystic ovary symptoms. Now, there are a few different things that in PCOS I want to point out in here, but we talk about in the future. And because PCOS is a hormone problem, it's a hormone imbalance. So you can't get to the right hormone and to stimulate the ovaries to release the egg, the mature eggs, right? And PCO and PCOS are two different things. Polycystic ovary and polycystic ovary symptoms is totally two different ideas. I want to share with you in here. PCO, polycystic ovary, which means you can't release the egg, and there are a lot of eggs that remain in the not uterus, ovary, and it becomes a large ovary, a lot of them in there, and waiting for release, and it can't release. Okay, and the good news is it can become smaller and it can release. It can release through Chinese acupuncture. Alright, that has been proved. And PCOS is, yes, you have all this little thing, but you also have overweight, hairy, like the hair in here. A woman get hairy in here, and women get hairy up to the belly button. You know, the hair comes to the belly button. Those are the symptoms. Okay, but PCO, like polycystic ovary, if you get a scan, you find that, oh, I can't release my egg. and you keep missing your period, or your period keep extend. Okay, releasing it is not on the normal time, not in the ovulation period. In some patients, they are very slim, they are not overweight at all, and they haven't got extra here and here, or in here or here, but they only have multiple cysts in the ovary, but no other symptoms. So it's two different ideas. Okay, and because I've seen my patient, they're very slim and walk in and they say, oh, I've been diagnosed for PCOS. I said, well, you're not overweight, first thing, and you don't have extra here, but I can see it. And then we check this area, there's no extra here. I said, no, you're not a PCOS patient, you are a PCO patient. So two different ideas. Okay, two different ideas. Okay, pelvic inflammatory disease, PID. So a lot of inflammation, infection in the pelvic, and that's another main cause a lot of infertility in female. Endometriosis, a lot of pain, and every month, and bleeding can be in the nose because the uterus lining grow in other areas. It's not supposed to be. We talked about that a couple months ago about endometriosis, right? Uterine fibroids is another common. So the fibroid will be in need to couple things. The size of the fibroid, that's one thing. You have fibroid, it doesn't mean you can't have your baby. You may still get pregnant, but as the period going, as the baby grow, the fibroid grow as well. But some of it grow, you have to complete. See which one complete with which one grow faster. Okay, if the fibroid grow faster and larger, much larger than the baby, then it causes miscarriage. It all depends on the fibroid. Where is the fibroid in the size and the fibroid? If the fibroid is in the uterus, a lot of them in there, and that actually affected. If some of them is not, is on other area, then that's fine. And some of them causing some problem if it's much lower and it grow and the baby go on top, and when it comes to label, it's a problem. It's a risk, very risky, because if the baby pass and the fibroid stay, the baby can't come out. So there are a lot of things to discuss in fibroid, but fibroid is one of the common cause of female infertility. Okay, premature ovaries failure. Well, we talk about, well, you can't use up all your eggs, right? But the eggs rely on the live in the ovaries to developing in the ovaries. But if the ovaries start to fail, the function is weak and weak. It doesn't matter how the normal ovaries function you have. If it becomes weaker and weaker, it can't develop the eggs, and there's no use. Okay, so we use acupuncture in Chinese herb to help with the ovaries function again. Just like we help the organ refunction again, we balance the organ function again. The same thing we can do, rebalance, treating the ovaries function again. When it function again, it can develop eggs, it can release eggs properly. Okay, so those are important. Scarring from previous surgery, and we talk about that as well. The scar, if you have miscarriage and you get DNC, or some female, they get abortion, you know, and those cause scar on the uterus, and the scar in the uterus, it actually prevent the lining grow on the scar tissue. When it can't grow the lining, so the embryo can't attach on the lining. So depending how big the scar tissue and how many scar tissue you have in the uterus, and that is something that's very difficult, very difficult. Who can heal a scar tissue in the uterus? Now we can still help to increase the blood flow on the scar tissue, and hopefully it will grow a bit of lining around it. Okay, this is something that we acupuncture can help, because scar tissue, when it forms, it actually decreases the blood circulation. So when it decreases blood circulation, not just the scar tissue that it can't form lining, is this, the whole uterus hasn't got enough blood flow, then it can't grow the lining. So yes, acupuncture in Chinese medicine can help with increasing the the blood flow into the uterus. And when more blood flow into the uterus, it develop better lining in the uterus. We're not talking about healing the scar tissue, because we have not proved that we can heal the scar tissue through the acupuncture on the outside and Chinese herbs, and taking it and to heal the scar tissue, to get rid of the scar tissue. We have no proof on that yet. Okay, but to increase the blood flow, there is actually a lot of proof on that, and helping the whole environment in the uterus, and get the lining thicker in other area apart from the scar tissue. All right, around the scar tissue, not on the scar tissue. Does that make sense to you? Okay. Now, medication and drugs. So what? There's other things. Medication. What medication actually impact female infertility? So certain medication and drugs can affect female infertility. Oops. I think I want. Oh, okay. One of my device went off because of I accidentally unplugged the. Oh, that's on YouTube, unfortunately. Cut off. Oh, I can't do anything about it. That's okay. Chemotherapy and radiation therapy. Now, if you have cancer or tumor, and you went for chemotherapy or radiation therapy, and that actually affects the egg quality, it kills the eggs. Not just that, your hormone are out of balance. Then there's nothing that it can impact infertility, female infertility. So what else? Aspirin, ibuprofen. So a lot of people didn't know that they have pain, they keep taking ibuprofen, painkiller. Why is that? Because painkiller is causing a lot of organs imbalance, and painkiller is actually causing thinning your blood. It's what causing the blood issues. And aspirin as well. You know, people use it for high blood pressure, thinning the blood. It's not a good thing. Of course, we are talking about long-term use and high doses use of painkiller and aspirin. So you need to stop those medications. You know, or decrease those medication. Does it make sense to you? Recreation drugs such as cocaine, what cocaine? I think it's cocaine, and marijuana. Well, in New Zealand, I haven't seen anyone that came to me and say, "Well, I have cocaine," but a lot of people in pain they use marijuana, because a lot of patients they actually grow themselves, or they can get it in here, and some people work on it, the politicians work for that, to try to get this marijuana things to be legally used for people. Okay, right? So those are the things, the medication that I can think of to mention that to you. The bottom line, okay, according to the Mayo Clinic, right, ovulation problem cause around 1/4 of the infertility issues seen in the couples. Okay, and irregular and absent period are two signs that a woman may not be ovulating. Okay, so if you, that is often from the PCO. Okay, now I want to point out that some patients what we just talked about cover up is the medication one, medical conditions and risk factor, overweight, smoking, all this, and cause and ovulation, all this thing, right? We cover as much as we can in here, but they are patients who ovulate on time, 28 days, just about all perfect, and no medical conditions. They're healthy, then the period is regular, on time, monthly, and the main sperm are all normal, and they still can't get pregnant. Okay, and often they say this unknown infertility, and when I'm sure you will see some if you're a practitioner. Okay, don't trust it, don't believe it is unknown, no reason that causing it. That is in the Western medicines. They couldn't find out anything from the test, from the test, and from what from the lab. Okay, any kind of test, they couldn't find out anything, but it doesn't mean they are normal according to Chinese medicines. Why is that? You need to ask the period, because as I mentioned yesterday, the current fertility specialist, the doctor, they don't ask about period, and they make patients think about having pain while they have period, having pain while they ovulation is normal. To get PMS is normal. The patient get wrong idea. Why am I saying that? Because when I ask my patient, they've been to fertility associates. They've been to well, we have fertility clinic here called fertility associate. That's why I keep saying fertility associate. It might not make any sense to you. It's a fertility clinic. They've been to a fertility clinic. Then what they said about us, I asked them, do they ask you about your period? No. Did you tell them about your pain? No, they didn't ask me. Or some of them they do ask. the patient said yes. I told him all about it, about my period, about the pain, the cramp, about my ovulation pain, and they not seems to be interested. They just run the test and everything's fine, and they say there's no reason, they can't find any reason that you can't get pregnant. I said, wow, that's bizarre. Why is that? Because you have pain when you have period, you have PMS, it's very, very severe, and you have pain while ovulation. That's abnormal. They don't have medical condition. It doesn't mean, well, I would say they have medical condition in this case, but they don't have the medical condition that we just named: endometriosis, PCOS, hormone imbalance because everything's fine, and pelvic inflammatory disease, and endometriosis, premature ovary failure. They don't have all this big thing, common medical condition, but they have the condition of pain, they have condition of clots, they have condition of emotional and breast tenderness and pain due while ovulation. All these things are medical condition as well, according to Chinese medicines. But according to Western medicine, they don't seem to care about this. Why is that? Because they can't do anything about it. They don't know what causing the pain. They don't know why the hormone test off normal, but why are they still get PMS? Why are they still emotional? Why are they still get breast tenderness? Those are the things that telling us that they have symptoms, they have condition while they have period and ovulation. You just have to treat those things, bring them down with no problem at all, and smooth happily while they have their period. Then they will naturally get pregnant. Does it make sense to you? Well, I just want to point out this. When you will see that they say, well, I run all the tests, I even been to IVF and not successful, and there's no reason. They said there's no reason for me to get can't get pregnant, and you sit down and ask all those questions according to Chinese medicine, and you find out a lot. There always reason, there always problem. You always can find some conditions, infertility, female infertility. Okay, so be in mind that when the patient come and talk to you that there is no reason, don't believe it. Find it out yourself. Okay, well, that's it for today, and stay awesome. We're gonna talk about male infertility causes tomorrow, so we skip one to the other: male, female, male, female, male, female, male. Okay, same topic of causes, treatments, and all this thing will be the same, but we change the topic for male to female, because it's two different area. Okay, when it comes to infertility, we put it all together in infertility that will slowly cover everything. Does it make sense to you? So if you find that this live video actually help, please comment down there and let me know. Does it help you? Does it give you something much clearer what's going on? Okay, so stay awesome, and I love you all. See you tomorrow. Bye bye. Veronica said, thank you, Sunan. My husband said, very interesting, very grateful, and have a great day. Thank you very much. Say hello to your husband. Okay, stay awesome. Bye bye.